Hi everybody, this is James here from Molloy's Pharmacies. I'm just doing this Facebook Live for a couple of questions that we got in earlier on today. And one of the questions that we got asked a lot about was constipation. And constipation is quite common and sometimes we often overlook it. So what I'm going to do today is I'm going to give a couple of ideas in relation to the treatment of constipation. And one of the things I'm often asked about, how do you define it or whatever. I often find is that people who don't go to the loo or don't have a bowel movement for a period of 3 days, and when they do go, they get a lot of pain and a lot of strain going to the loo. So from that point of view, what we're trying to look at here is how exactly do we actually improve that, and what are the causes. And a lot is to do with lifestyle. Dehydration, not drinking enough, not doing enough exercise, can also be down to the correct medication, because sometimes they can give side effects as well. So on that basis, there's actually also a disease that you can call, that is genetic in form, called Hirschsprung disease, where the actual nerves going to the bowel aren't there, and that can cause constipation as well. So from that perspective, what are we looking at treatment? Well, there's two things that I always suggest. Number one is improve the diet, get lots of fibre into the diet. Number two is exercise. Very, very important. Even a 20-minute walk every day, that increases the peristaltic motion in the gut. So if things aren't working out, what I always recommend is a good fibre. If we have a look at one here, Benefit Multifibre Plus, very, very safe, very, very effective. It's also got pre and probiotics in it, and the fibre itself is what's called a soluble fibre, which is very, very safe, and it actually bulks up what's actually in the system and makes it a lot easier to pass. You can also come across OTC medicines where you get the likes of Dulcolax tablets, which are very, very safe and effective as well. What I would stress here is, and what is quite common I find a lot as a pharmacist, is that a lot of people become over-dependent on these type of products. And the difficulty there is that when people stop them, they can really struggle with constipation. So you get into this really bad cycle, and you have to break that cycle. And the way that you do that is to try and gently come off those tablets, and then basically improve your water intake, your hydration, as I say, your exercise, and increase the level of fibre in your gut. And very, very important is your pre and probiotic content as well.